part of what we're doing with 1 Million Solutions in Health is we're going to be posting the proceedings from tonight on YouTube and on our website. The idea is that 1 Million Solutions in Health is trying to get 1 million solutions and then share them all around the world with people. So if you have ideas, if you have some passion about what should change in healthcare, this is your opportunity to talk about that tonight. And we have 5 great speakers who are going to share their ideas with us as well. On your, when you came in, hopefully everyone got a copy of our sponsor list, which I'll go through in a minute. And we also put on your chair a volunteer form if you'd like to volunteer for our organization. This is what it looks like. It has a little yellow thing at the bottom here because we are a not-for-profit organization, and to get this message out across the world, we're going to need a whole bunch of help. So just to go through the slides for a moment, tonight's event is called Bringing Toyota, Apple, and Lean Thinking to Healthcare, creating some solutions, and using social media to do that. So 1 Million Solutions in Health is really a global movement connecting people and sharing inspiring ideas. And we would like to reach out to people in the health industry, to patients, to healthcare practitioners, to people in academia, to government, and to students and the youth of today. Everybody has a different perspective, whether you're in the middle of a healthcare crisis, whether you have a chronic disease, whether you just want to be fit and trim and live to your 110, whatever the case may be. There's lots of things that can be done, and this is part of what we're all here together to learn about, is how we can move things forward. Just to go through quickly, the sponsors for this evening's event, Health Connections is a full-service healthcare services company providing everything from strategic consulting to market research, continuing medical education programs, and digital marketing to social media. We have the Wharton Alumni Club, Wharton Penn Alumni Club of Toronto, representing about 1,500 Penn and Wharton graduates who live within a 100-mile radius of Toronto. We have the Access Group, actually my partner sort of in crime, so to speak. Taimur Zaman heads up the Access Group, and he's created an initiative called 1 Million Acts of Innovation, which was built on the Cisco initiative called 1 Million Acts of Green. So you're here for continuing the 1 million theme, but in 1 million solutions in health. So I thank Taimur for all his help there. We also have, actually, if Tina wants to raise her hand. Tina, right there in the second row, is the president of Global Food Safety Resource Center. It's a worldwide organization bringing safe food practices in health forward. And it's amazing once you learn about food and realize that food is so very similar to health in that you have issues like salmonella, E. coli, et cetera, et cetera. So it's really important, and we thank her for being a sponsor this evening. Cyclera is the maker of NutriBasic, and on your document here, if you click to NutriBasic, you can get through NutriBasic a free a tool that they have donated to us to give to all of you. And what it is, it's a way to input your food that you eat on an everyday. Now, some people might want to do that because you're trying to lose weight. Other people might want to be looking at their salt intake. But every time that you put your food into NutriBasic and what you've eaten, it produces for you one of those little nutritional labels so that you can kind of get an idea of what you're eating and how you're doing to move forward on whatever your goals are. So we really thank them for giving us that free trial for all of you if you just click on there. And if you have any questions, you can always contact me afterwards. We also want to thank Red Roof Communications. Helen Bucky Lloyd has been helping tremendously behind the scenes, as well as Adiola Fatuga, who's out there in the front from Health Connections. And both of them have been working tirelessly to make sure this event comes forward. And at the back of the room, we have David Moses, our videographer from DAM Studio. And we want to thank him very, very much for his efforts tonight in making us look wonderful, but even sound better, and our ideas getting across to the world. I don't think Maggie's in. Is Maggie in here, or is she still outside? I gotta go pull her in. So I'll be back in 1 sec. This is Maggie, for those of you who don't know her, and for those of you who are her professors, she gets A+ for this. But Maggie was so terrific. She approached me, I think, back in the spring, and said that she had an idea to create this event. And so we've been working tremendously. Maggie was able to convince 3 of her professors to come and speak with us this evening, and then reach out to all of her friends and colleagues in industrial engineering. So without Maggie, this event wouldn't have happened tonight. So a great big round of applause for Maggie. Yeah, go ahead. No.
I also want to thank IIE, Institute of Industrial Engineering. Thank you, SWAT, for helping me out, and a lot of the other exec members for helping me out, helping me organize this, getting us set up, and kind of just giving an idea of what to do, how to approach the profs, and how to book the rooms, and all the logistics. Thank you.
Great. Well, thanks again, because without Maggie, it wouldn't have happened tonight. And then also one of our speakers, Carolyn, is from the University of Cambridge, so we want to thank them for giving her permission to talk about her most recent work. So thank you. And as I mentioned before, there's your free trial from NutraBasic if you just go to that sponsor page and click on their website. So again, as I said, there are volunteer sheets. Please see if you would like to volunteer. It would be great to have you join our team. And so the agenda for tonight is we're going to talk about, the speakers are going to talk about some of the problems, some of the solutions, some of their ideas, some of their research, some of their learnings, hopefully to give you some thoughts and some things that you might want to consider. You have some paper, maybe if you have a pen, or there's some pens also up here. There's some pads up here if you want to take any notes. But after we hear from the speakers, we're going to break into small groups, and I will mix you up a bit so that you're not just with your best friend who you're sitting next to. And we're going to create some ideas together, and then we'll spend about half an hour doing that. And then after we're done creating the ideas in small groups, we'll get together and we'll come up to the mic here, and one representative from each of your groups will share with us what you came up with, so that again we can share your ideas around the world. So it's very interactive, and if you have something you've always wanted to tell 100,000 people, then tell them tonight, because you're going to tell 100,000 people through our mailing list, and eventually you'll be one of a million ideas that people can use and share around the world. So just to introduce our speakers for this evening, we gave you a quick bio of each one in the invitation, but I'll just read this through it now just to move forward, and then we'll have each speaker just come up. So Michael Carter will be our first speaker. He's the director of the Center for Research in Healthcare Engineering and a professor in the Department of Industrial Engineering at the U of T. Harmeet Atwal, who's sitting there second, currently serves on the board of directors of the International Society of Pharmaceutical Engineers in the Ontario chapter, right, or the Canadian chapter, sorry. My page is just cut off a little bit. It wasn't engineered properly. And he manages operational performance and methods projects for Sanofi Pasteur. Dion will be next. She's at the far end. She's the Director of Medical Operations Research Laboratory and an assistant professor at the University of Toronto. Her research uses optimization models to increase efficiency while minimizing potential harms in medical procedures and organ transplant and radiotherapy. Carolyn, who's just to this side of her, recently completed her master's degree in engineering design for healthcare at the University of Cambridge. Her research is entitled Applying Inclusive Design Principles in the Assessment of Patient Experience. It's investigating barriers that UK patients face when physically assessing NHS services, and involves applying population data using inclusivity tools to highlight the problem areas along the patient journey. And our last speaker is Mark Schignell, and his research is focused on healthcare ergonomics and ubiquitous computing. And he's an engineering professor at the University of Toronto as well, and is also the founder of the Vocalage Incorporated and author of 4 books.